Welcome back. In the last video we covered what an AVF is and why dialysis patients need it. Now we go deeper. We are going to look at the different types of AVF, where each one is placed on your arm, and then I will walk you through exactly what happens on the day of your surgery, step by step, so nothing surprises you. Not all AVFs are created in the same location before surgery. Your doctor will order a Doppler ultrasound, which is a painless scan that maps the size and health of your vessels. This is the surgical roadmap. Based on that scan, your surgeon chooses the best location. There are three main types. Type 1 is the radiocephalic AVF. This is made at the wrist, connecting the radial artery to the cephalic vein. It is the most preferred type. It is the most distal, which means it is farthest from the heart, and if it ever fails, the surgeon still has options higher up the arm. Think of it as preserving your options. Second type is the brachiocephalic AVF. This is made at the elbow crease, connecting the larger brachial artery to the cephalic vein. Because the vessels are bigger here, the AVF tends to mature faster. However, there is a slightly higher risk of a condition called Steele syndrome, where enough blood is not going to the hand, causing coldness or numbness in the fingers. Your doctor will monitor for this. Type 3 is the Brachiobasilic AVF. This is done in 2 stages as basilic vein runs deep inside the upper arm, so the surgeon needs to bring it up to the surface during second stage of surgery. It is a more complex procedure but produces an excellent AVF when the other vessels are not suitable. Your surgeon recommends the right type based entirely on your own vessel size, and there is no one size fits all. Now let's talk about what happens before your surgery. First, the Doppler ultrasound. A painless scan of your arm that scans your blood channels, including the size, depth, and flow. The surgeon uses this to plan exactly where your AVF will be created. In the weeks before surgery, you may be asked to stop certain medications, especially blood thinners like aspirin. On the day itself, you will fast for 4 to 6 hours. This is a day-case procedure. You arrive in morning, have the surgery, and go home the same day. On the day of surgery, your arm is cleaned and sterilized. Local anesthesia is injected, numbing your arm completely. You will not feel any pain. You may feel gentle pressure or movement, but zero pain. Some patients also receive light sedation to help them relax. The surgeon then makes a small incision, just 3 to 5 centimeters, near your wrist or elbow depending on the type of AVF planned. Now comes the most important step, the anastomosis or connection. Using sutures thinner than a human hair, the surgeon stitches the vein directly to the artery, creating the connection. This precise microsurgical work takes about 20 to 30 minutes. Every stitch is placed with care. Before closing, the surgeon presses 2 fingers gently onto the newly created AVF and feels for the thrill. That gentle vibration that confirms blood is flowing through. When the thrill is confirmed, then the AVF is alive. The wound is then closed with absorbable stitches and your arm is bandaged. You will spend a couple of hours in recovery before going home. After surgery, most patients have some mild pain and swelling for a few days, which is completely normal. The wound heals within 1 to 2 weeks. And now begins the most important waiting period, maturation. Your AVF needs time to grow strong enough for dialysis needles. We cover that in full in video 3. But first, remember, check your thrill every single morning from day 1. So, to summarize, there are 3 types of AVF and your surgeon chooses based on your own blood channel anatomy. The surgery is done under local anesthesia as a day case and takes under an hour. The most important step is the anastomosis or connection, and when the thrill is confirmed, your fistula is alive. In video 3, we will cover AVF maturation, how long it takes and what you can do to speed it up. Subscribe and hit the bell so you catch it when it drops.